Well, scientists, health activists and policymakers are gathered in Ivory Coast capital this week for a major AIDS conference. The International Conference on AIDS and Sexually Transmitted Infections in Africa, or ICASA, will focus on ways to end the pandemic on the continent. This year's theme is Africa Ending AIDS, Delivering Differently. Our health correspondent, Linord Moudou, is at the conference in Abidjan and joins us live via Skype. Good evening, Linord.
Hello, Vincent.
Yeah, now first,
as you mentioned, there's excitement here in Abidjan a couple of days after the end of the EU-AU summit. It's now the 19th International Conference on AIDS and STIs, ICASA 2017. More than 5,000 people are gathered here in Abidjan to assess the global fight against HIV/AIDS, but primarily what is happening in Africa. As you know, the HIV/AIDS is infecting millions of people around the world, and many of them are in sub-Saharan Africa. So there is a lot going on here. Researchers, doctors, civil society, advocates are gathered to recommit efforts for an AIDS-free generation in Africa.
Yeah. Now, we know that in this kind of conferences, a lot gets to be discussed. Up to this point, what has stood out? What has stood out?
Really, one of the main focus here is the issue of prevention of mother-to-child transmission. It has been a main focus. We have several first ladies that are attending the conference, and that they have made that one of the key issues for them to work on. And the first ladies have an organization called UPDAS, and what they do is to fight against HIV/AIDS, and they are really committed to ensure that no child gets born with HIV/AIDS moving forward, because there are all the tools and treatment to prevent that from happening. Now, and also they're talking about funding. They talk about new strategies, but one of these strategies will be access to funding, and it will be critical in terms of assuring that Africa really wins the fight against HIV/AIDS.
And we know that these conferences have taken place over the years. What are they talking about? What has been achieved, and therefore how to move from there forward?
Has been achieved. When you look at some statistics, for example, access to treatment, treatment for prevention, there are more people on treatment than before. But moving forward, one of the key issues is the 90-90-90 targets by UNAIDS, which is by 2020, 90% of people that are infected by HIV/AIDS should know their status, and those who know their status, 90% of them should be on treatment. And for those who are on treatment, 90% of them should be virus suppressant. So, which means that if we are able to achieve this target by 2020, it will be a big step in the fight against HIV/AIDS. So this approach is really, really essential. Also, the fact that young women are getting infected, the infection rates is increasing among the youth population, and that is a serious issue that they're really trying to address. More than 300,000 adolescent girls and young women were newly infected in 2016, and that's a serious issue when you think about the global fight against HIV/AIDS. So the main focus is about access to reproductive health and access to young women's rights and women's rights in general, because you look at the issue of gender-based violence, that's one of the reasons why there is also an increase in new infections, and many other issues, really, the lack of access to reproductive health in some contexts that young women don't have. They are not educated to know how to prevent the virus from infecting them, and many other repercussions.
Excellent reporting, Linord. Thank you very much for joining us today.
Thank you, Vincent.
That's Africa 54's health correspondent, Linord Moudou, reporting live via Skype from Abidjan, Ivory Coast, where she'll be all week.